Dr. Gilbere, would you please enlighten us about skin disorders? Now, a couple of the discussions we've had have alluded to skin disorders.
Right.
What are they? How prevalent are they? And what are some of the things that we can do to help avoid them and to treat them naturally?
I would say that probably what I see in the practice the most is psoriasis, eczema, or eczema, as people know it, and rosacea.
Okay.
Now, rosacea can be a hormonal imbalance as well. So that one we have to really kind of put aside as something that is caused from a toxic condition in the body, whether it be a microorganism or just exceeding the body's burden. So, but even rosacea is helped by reducing the toxic load in the body. Okay, but we have to keep in mind that that can be caused from a hormonal imbalance, too much testosterone, not enough, too much progesterone, not enough. So depending on what that female hormonal panel shows, a lot of the cases can be cured by taking hormone therapy. And you need to work with somebody to do natural therapy. But as far as the eczema and the psoriasis, most of the cases of psoriasis I have found, as we mentioned earlier, are caused by parasites.
Oh, really?
Absolutely,
Yes,
and especially when they accumulate in the joints. Now with eczema or eczema, as some people know it, there's a multiple, it's a syndrome. Because most of the time, if it's in children, it's usually an allergy to something that they're eating. It's either wheat, corn, or dairy, in most cases. When you eliminate that completely out of their diet, and there again we go back to patient education and reading labels and understanding what the aliases are, like we talked about this morning with the MSG, that we have to know that it comes under many disguises. So hydrolyzed vegetable protein may be MSG. The same thing, there's other names for sometimes corn products or corn syrup solids, and people don't realize it's still corn. So by reading labels, you understand that you can get out all of the corn, the dairy, and the wheat, and you use, you know, the only way to do it is to use an elimination process, an elimination diet. If a child has eczema, cut the dairy out first. And usually it's about 4 weeks in a child that you can tell. If it starts improving and it gets better and better, you know it was the dairy. If it's not, then go to the corn. It's the only way. That's how allergists do it. It's the only way that they can do it, because short of giving you 100 needles in your body to see which one's going to swell the most, there isn't any other really good reason medically that you can use other than the elimination diet. And so then for the toxic load of the body, all skin diseases are improved by reducing the total body burden. So by making sure that you have plenty of fiber, by cleaning out the intestines, by supporting the liver and the lymphatics. So there's products that we use in homeopathics and in herbals that support the liver, the kidney, and the lymphatics. It's very important because they all work in synchronicity, and that's part of the whole health puzzle, is that you can't take care of one and not the other. If you're overworking the liver and you're not doing anything to reduce the toxic load in the intestines, the liver is going to continue to deteriorate, and then the kidneys and the lymphatic system will be next.
So there are supplemental procedures that you can take either for each of those or all three of those
Absolutely.
Organs, right?
Absolutely.
Organ systems.
And those are the main organs of detoxification.
Thank you.
You're welcome.